Hi everyone, my name is Ben, and I'm a PT at Bodies in Motion in Fairfax. Today I'm going to explain the misconceptions of the IT band syndrome and how to properly execute a reverse clamshell, which is commonly used in treating IT band pain. So IT band syndrome is commonly seen in runners, where they complain about pain, stabbing pain, usually on the outside of the knee, which can also come up to the thigh. So the tensor fasciae lata is the muscle that's at play here. It comes from the ilium, extends all the way down into the tibia, which we call the IT band. But we should also note that the outer aspect of the quads, the vastus lateralis, can feed into it. The posterior aspect of glute max can also feed into it. And lastly, the lateral aspect of your hamstrings can also feed into it.
Okay, so I have my lovely wife here for my example, as I have treated her for IT band pain. And so what I want to talk to you about is what is IT band pain. So there's articles out there that are saying that it's the femoral condyle that's getting irritated. The IT band is flickering over that femoral condyle when you're stepping, when you're bending your knee, when you're planting your leg, when you're running, things like that. But there's also articles out there that are saying that it's the highly innervated fat pad on the outside of the knee that's getting compressed. Now, this is true, but something could be getting irritated, compressed, but what your licensed PT should note that it's your movement history that's the problem. So for this specific example that I'm going to show you an objective measure that I tested, explain that, and then I'm also going to show you one of the treatment exercises that I used to overcome this issue. So now there's multiple things that you would do in an exam, but this specific measure that I'm going to show you is a very common measure. It's called the Ober's test. And so what you do with this is you place your hand here on the thigh and you fixate it and you grab it underneath the knee here. And so what we're testing here is our ability to adduct the hip cross midline. So when I come here, we can cross midline. But the problem is when I extend the hip, that's where I have trouble. That's where there's a bounce and we can't drop, right? Can't feel that drop. So this is something wrong with the mobility of the pelvis and some muscles around the hip that are underactive, which we're going to engage in the next exercise. So the IT band is overactive. Is another thing that we're saying here, that it's under tension. And so what we're trying to do is take away that tension by feeding it the proper muscles, which is going to be glute medius, the adductors, and then also transverse abdominals, because we all need that, a little bit of deep core strength. And so what I'm going to show you here is the exercise next. So this exercise is the reverse clamshell. You're going to get the ball that's roughly this diameter, like 6 inches. And so you're going to put that in between knees. Now you can use a foam roller, that's another good option. And so what you're going to do is stack your hips and knees at a 90-degree angle, and you're going to shift your hip backwards ever so slightly, and then you're going to press your knee down into the ball, and then you're going to rotate your hip towards the ceiling. Now commonly I see an error here, is when they do that, they kind of do that. They're cheating. And so they're using a little bit of like their back muscles to do that. So you want to make sure that they can maybe tuck their tailbone a little bit, relax the back, do the hip shift, press the knee into the ball, rotate from the femur. You want to make sure that they're spinning from here. That's what's lifting here. And then she's going to hold this pose. So she's pressing into the ball. We're going to do a checklist here. Do you feel adductors?
Yes.
Do you feel funky feeling back here?
Yes.
So she's holding it, she doesn't like it, and we're gonna hold this exercise, and you're gonna do a count of like 4 breaths. So you're gonna breathe in through your nose, and exhale out through your mouth, and as she exhales, she's trying to bring her ribs kind of towards her back. Okay, and then she's gonna do about 4 of these, and that's 1 set. And so this is how you properly execute a reverse clamshell. Now you can also do this in repetitions, just going up and down in this pose. But for me and for her, what we needed is to establish all these muscles at once and to connect them. And so she's done her 4 breaths. She comes down and then hold on to that ball. And then we're just going to recheck to see if we made any changes in terms of activating the muscles that we needed to see if we can inhibit the TFL IT band. So relax the thigh again, fixate from the hip. I'll rotate her hip back. Already feels a little bit better for extension. And then she relaxes her thigh. And then we can drop down a little bit closer towards midline. And so that's the exercise.
Thanks for watching. Be sure to check out our channel for videos on other physical therapy topics. If you haven't subscribed yet, please subscribe. And if you enjoyed this video, please hit the like button. Leave a comment and share it with others.